Hello, I'm Dr. Bryan Hulsey from Foundations Chiropractic and Functional Medicine in Corvallis, Oregon. The reason why you're watching this video is because you or a loved one is suffering with fibromyalgia. So I want to let you know that there is hope. There is something that can be done to help manage fibromyalgia. Not necessarily more medications, Cymbalta, gabapentin, pain medications, sleep medications, depression medications, possibly thyroid medications, so the list can go on and on. I want to let you know that there is hope. Why? We treat every patient in our office both neurologically and metabolically. So we look at brain function and we look at internal function there. So if you're dealing with debilitating pain, possibly migraine headaches, low energy, chronic fatigue syndrome, all of these symptoms that add up to fibromyalgia, I want you to know that there is hope. Okay? So we need to, like I said, we address every patient both metabolically and neurologically. So why do we do this? So what is metabolism? In its purest form, metabolism is taking food and converting that to fuel. Many patients with fibromyalgia that I have seen have a few things going on. A blood sugar issue, either diabetes or hypoglycemia. They have a thyroid issue, and or they have food sensitivities. So if we're having issues with food, then we try to get that into the system. That's like putting diesel in a rocket ship there. So this kind of gives the idea of garbage in, garbage out. So we take food and convert it to fuel. How can we monitor that? This is through specific lab tests. So the lab tests that we run are a CBC, or a complete blood count. We look for signs of infection and anemia. We do a comprehensive metabolic panel looking at kidney, liver, and organ function. We look for markers of inflammation with a high sensitivity C-reactive protein, homocysteine, uric acid. We look at vitamin D status. We do a lipid panel, and we do a full thyroid panel, including TSH, total T4, total T3, free T4, free T3, antithyroglobulin antibodies, thyroid peroxidase antibodies, and T3 uptake. So we need to look, those are just some of the lab tests that we need to look at. We also need to look at an adrenal stress index, likely because of issues with sleep and energy production throughout the day. And we need to also look at maybe some underlying signs of infection. So if we have an issue here, we run these lab tests. This is going to tell us how well our body is taking food and converting that to usable fuel, which is ATP, or adenosine triphosphate. Now the good majority of this fuel, upwards of 30% of that, goes to feed the brain and the nervous system. So if we have an issue here, and the brain is our most metabolically active organ, we're going to have brain issues. The standard fibrofog, or depression, or anxiety, or sleep issues there, the brain fatigue. All these things are fairly commonplace with fibromyalgia. So again, we need to look at both neurologically and metabolically. We also look at how well the body organs are working. We do this by way of called a quantum reflex analysis. This is testing specific acupuncture points on the body to see how well those organs are functioning. By employing all of these methods, this is how we can get to the root cause or causes of a particular condition. It's very uncommon for each person diagnosed with fibromyalgia to have the same underlying metabolic factors there. Some of them that may be commonplace are blood sugar issues and thyroid. So we definitely need to address those. Again, you're watching this video because you're hoping for a solution to your pain, to your sleepless nights, to your days that don't have energy. I want to help you get your life back there. So So our clinic has 3 main goals. So our 3 main goals: 1, I want to reinvent your life. So by that, whatever it is that you enjoy doing, I want to help get you back to that there. So with fibromyalgia, many people have lost their joy of activities. I want to help you get that back, whether it's playing with your grandkids, walking on the beach, playing with the dog, just getting through your day. I definitely think we can do that. 2 is have a positive impact on everyone I come into contact with. And number 3, this is a big one, I want to give you an exit strategy. So exit strategy meaning I want to find a way to get you to seeing less of the doctor or doctors, whether it be the neurologist, your general practitioner, the endocrinologist, the psychologist, because everybody said it's all in your brain, it's all in your head there. That we need to, again, to do that, we need to put all the pieces of the puzzle together. Neurology, physiology, metabolically, and then how our particular organ systems are functioning. If this is striking a chord with you and you're ready to find a solution for your ongoing problems, for you or a loved one, I want you to call today. Don't hesitate. Pick up the phone. Call 503-349-3024. Request our information on fibromyalgia. It's about an hour long, hour and 15 minutes long, outlining all of these particular steps. So again, please don't hesitate to call today. I want to help reinvent your life. 503-349-3024. I'm Dr. Bryan Hulsey from Foundations Chiropractic and Functional Medicine in Corvallis, Oregon. I look forward to helping you soon.